Our next speaker is Jennifer Coffey, who is from Manchester, New Hampshire. She's a member of Rights and Democracy, the People's Action affiliate that covers Vermont and New Hampshire. Jennifer is a breast cancer survivor diagnosed with complex regional pain syndrome. Jennifer spent years struggling to make sure her doctor's visits and medicine would be covered by her insurer. She is also a former Republican state representative who, through personal experience, now understands the need to move toward a Medicare for All system. Jennifer?
Good evening. My name is Jen, and I'm from Manchester, New Hampshire. And at one time, I was a fully functioning EMT, and I joked that I lifted people for a living. Then breast cancer surgery went wrong. I ended up bedbound for 2 years, and I lost everything. I felt like I was going to be trapped forever in my bedroom. I developed complex regional pain syndrome, the most painful disease known to medicine, and small fiber neuropathy. Rules imposed by my private health insurance company, United Healthcare Medicaid Disadvantage, consistently overrides my care team's medical expertise. I've yet to figure out how my private health insurance can actually help me. Because my private health insurer refuses to cover my care, I was forced to make a GoFundMe and sell my possessions to afford treatments. With the help of People's Action's Care Over Cost campaign, I was recently able to get approval for my next infusion. I worry, though, that when no one is looking, United Healthcare will not approve any more treatments. Things got bad really fast last year. My illness was progressing, and I was forced to ration infusions because my rent was hiked up $400. My neurologist started me on LDN, low-dose naltrexone. But the pharmaceutical company that makes the medication will not make it in the low dose that I need because it's not profitable for them to do so. I've had to use a compounding pharmacy to get the medication, and I've had to use 5 different pharmacies in order to keep costs down. Again, my Medicare Disadvantage plan through United Healthcare will not cover it. Insurance companies serve no purpose in medicine. They decrease positive outcomes. America is arguably the best medical care in the world, but only if you can buy it. This is not a Democrat or Republican issue. This is a human issue. It's disgusting to watch United Healthcare brag about over $8 billion of profit earned in just 3 months, and they deem me too expensive to keep alive. I'm excited about this work. Anyone who needs care will get it, no matter who they are, no matter where they're from. Right now, there are millions of people across this country who are organizing, and we want Medicare for all now.
What we're going to do now is have a little discussion among the panel, then we'll open it up for a few questions and comments. All right, let me start off. All of you are practicing professionals. You're out there every day dealing with patients. Talk a little bit about your experience with patients who walk in the door, who are uninsured or underinsured, and what impact that lack of insurance has had on their lives and your ability to provide the care that they need. Who wants to jump in on that one? Please.
As a nurse, I have to say to you, we have the front row of the devastating cruelty. I have multiple of examples when a patient's come in. I had a young man who came in because he was having pain in his leg for months, and then when we said to him, why didn't you go to the doctor? He said, my co-payment was $50 and I couldn't afford it. He ended up with stage 3 bone cancer, which was preventable if he didn't have the high co-payment. We had another young woman who was bleeding, and decided, you know what, she needed to feed her children. Then by the time she came in, she had stage 4 ovarian cancer. Also because of lack of care. You know, we come from a community where we also have people that are uninsured, also that are undocumented. At a young patient, because he was undocumented and was afraid that he was going to be deported, he had a toothache. So what happened, he ended up with a brain abscess, and he, yes, did not survive, just for simple care. I could give you millions of examples, what we see every day as nurses, doctors, all of us working in the emergency room, asking patients, you know, what happened. Or sometimes they walk in the room, they'll tell you without even you asking. The reason I didn't come, I couldn't afford it. Or I had to wait 3-4 months. Or I had to wait to the clinic. Or I couldn't get childcare. Or I couldn't get off work. So we see it every day. That's the reason we know, I know as a nurse, Medicare for all is what we need to stop the cruelty, to continue to care for our patients.
Who else would like to say a few words on what you're observing in your practice?
I often have women come to see me for contraception. They desire a specific form of contraception that will be effective for their healthcare situation. However, often when I see these patients, I have to run their insurance and see what they will cover. Most of the times, I have to break the news to my patients that they just won't be able to receive the coverage. This leads to my patients having to compromise in what medications they will accept, and it's also a compromise because I know I'm not able to provide my patients with care that is meeting their condition.
Yeah, so I take care of a lot of families where there's a lot of mixed immigration status. So just to give you an example, I have a family of 5 that I'm thinking of. The oldest child was born in Central America. The second one was born in the United States, but in a state that did not expand Medicaid and went uninsured for most of their childhood. The family moved to Maryland, where the youngest child is born. Mom and dad's immigration status is also mixed. Mom is in the process of getting citizenship. Dad is undocumented. And so these are 5 people who have been fragmented by our healthcare system, all having 5 different interfaces with healthcare, all of them, I mean, just barely holding their head above water, and really, I would say the parents are drowning with, not getting their health care met. And it's simply because their humanity wasn't enough eligibility for the system.
Let me switch gear, if I might, and talk about how much time and frustration you have in dealing with insurance companies who are making it difficult for you to provide the treatments you want for your patients. Who wants to talk about that one?
Well, I would make a couple points in response to that. I mean, first off, if you speak with any physician, they will talk about the enormous amount of time they spend on documentation, the electronic health record, billing and coding, and all of these activities that are really geared towards payment and not geared towards care. The reality is this translates into an enormous burden of cost on the healthcare system in the United States. On average, we spend about $80,000 per physician just to cover the cost of their interactions with insurance companies, 4-fold higher than Canada. In the hospitals, our hospitals spend about 1/4 of their revenue to cover the cost of armies of billers and coders to interact with insurance companies and chase after patients and so on and so forth. And that's twice the proportion of Canada. So again, there are an enormous amount of waste. There's an enormous amount of savings that we could use to actually cover everyone. And that's what we need to do.
It's interesting. I talked recently to a conservative Republican physician, and he said he would not recommend to the younger generation to get involved in the profession precisely because all of that paperwork and their inability to practice the kind of medicine that they want. Yeah, Pramila?
Bernie, when I was trying to build support from public hospitals for Medicare for All, I spoke to the head of a major public hospital, and he told me that they have 200 employees whose only job it is to fight with the private insurance companies to try to get the care that they have prescribed for their patients. So you imagine even what it takes for a hospital system to just be able to try to fight for the care that people bring. And I think it just shows how the costs line up on every single level. But also, I have many friends who are doctors or nurses who are leaving because they feel like I'm seeing so many nodding heads, they feel like they're spending 70% of their time arguing with people, and it's really what Sanjeev said, arguing with people to say, I am the doctor, I am the nurse, I know what my patient needs, and you are saying it's not possible. And that's just unacceptable.
My last question before we open it up is, what do you think it would mean for the health and decreased anxiety in this country if anybody could walk into a doctor or nurse's office whenever they felt they needed to without having to worry about how they're going to pay for it? What would it mean to the health and well-being of our country? Who wants to say a word on that one?
May I?
Yeah.
In my opinion, that would give me true medical freedom, where I am making the decisions with my providers and my family, and whatever is needed is done, and not some bureaucrat insurance person or computer denying care. The decisions about care needs to be between the physician and the patient and their family, and that's it. Medicare for All is the only way to do it.